Hello, welcome to Untold Facts. I am Moses Omogana. This is where we tell it just the way it is, however uncomfortable it may sound to you or even to me. I have very interesting and beautiful ageless guest here in this on set. I'm going to start with the first, Dr. Morenike she is an associate professor at the College of Health Sciences, Obafemi Awolowo University, Ile-Ife, and a sexual health and right advocate as well. Thank you so much, ma'am, for joining us. Welcome. And yes, the lady in black, she's Dr. Sekoni Adekemi, currently a senior lecturer at the Department of Community Health and Primary Healthcare College of Medicine, University of Lagos. Dr. Sekoni is actually an academician by right and practice. Thank you so much, ma'am, for joining us.
Thank you for inviting me.
Yes. I'm going to start with you, Morenike. Why should someone's sexual orientation or sexual preference even affect, their access to healthcare? Should this really matter?
I think I'm not going to answer to the yes or no. I'll answer with a lengthy statement. The yes or no is that access to health by whoever and whatever should not be influenced by anything. And that's building on the hypocritical talk of the physicians. It's about ensuring that whoever, whatever they are, have access to health, irrespective of anything. However, I think what we see in terms of discrimination of sexual minorities to access to health is a reflection of what the health system in Nigeria has deteriorated to be, where persons and healthcare personnel and medical personnel choose to discriminate based on personal values. And so you see a person have access to health and because of your personal values, you don't give people access to perfect sexual health, reproductive health commodities like condoms or contraceptive because you believe for whatever it is that an adolescent shouldn't have sex. And it's the same prejudices and personal prejudices based on whatever your values are that also limits health personnel from choosing who they think have a right to health, including sexual minorities.
All right, Dr. Sekoni, from what Morenike just mentioned, it's more or less personal values and prejudice. That in itself, sort of conflicts with the ethics of the practice. It means that on that ground, a patient can really sue, but we don't see this very often. Is it that people are not aware of, where they stand, or they're just too afraid to, bring this up as an issue of discourse?
Well, let me say that in the recent times, we've heard of instances where teaching hospitals and hospitals generally and healthcare providers are being sued, which is quite different from what used to obtain in the past. So I would say that with the increasing knowledge and awareness about rights, people are now trying to take measures to ensure that whatever it is that is supposed to be their rights, they get it. So I would say things are definitely changing in recent times.
What do you think, one can do, perhaps organizations or even the government or even, volunteers to help, health practitioners or health workers move beyond their prejudice? What can be done really?
Well, the first thing we need to realize is that healthcare workers they are from the society. Yeah. They are from healthcare workers in Nigeria and Nigerians from the Nigerian community. It's not as if they've come from somewhere else. So of course they've imbibed the culture, the religion, the social way of life of any normal Nigerian walking on the road.
True.
So what the medical training is supposed to do is to enable individuals who come in to be trained as healthcare workers to be able to render the services irrespective of their socio-cultural beliefs, upbringing, and issues like that. So maybe there's a need to see whether the training is actually achieving that.
Yeah, but isn't that where your professionalism comes to play, where you drop all values or personal prejudice and just do the job based on the books?
I think
what do you want to say, Morenike?
I think it's two things. The professional code says that, but believe that the professional code says that at the point when you're getting your degree. We swear to that oath. That oath should have been a fundamentals of the training, which means over your 6 years of training, you hear it over and over. You bring it up in class, you bring it up in the clinic, and then it becomes an attitude. Unfortunately, the approach of our training is supposed to form attitude, but I'm not sure the design currently does that. For example, one of the big ways to do that is about value clarification. And those value clarifications don't happen most times. You go to class, you take a lecture. During those lecture sessions, you're not clarifying values.
All right, so help me understand this. What best approach are you suggesting here? Are you suggesting, oh, I know who you are, I see you, and I love and accept you for who you are? Or the don't ask, don't tell principle?
Well, we are still back to the issue of taking into cognizance the cultural and social context, as well as looking at the objectives exactly that we want to achieve. In coming up with any strategy, I wouldn't take those strategy like this. I would rather take it as a continuum and see which one
best fits the scenario.
Not one per se. How can we blend? We probably have to end up with a blend. Because if you look at Nigeria, that's why people keep saying, oh, Nigeria is a peculiar situation. In as much as you don't take into context what is going on locally, socially, culturally, religiously, and you put it into your planning, then it's going to be very difficult to say, oh, adopt this strategy. No, it can't work that way.
Morenike, I'm itching to hear your reaction.
I defer to her because she's an expert and she has a very big field in growing that. But I also think in terms of approaches, we're talking about multiple approaches. I think that focusing on the medical field to change a prejudicious nature, I don't know what the English is. Excellent, that's why you're here, baby. You know, you're going to ask a community, a small community of medical persons not to be, prejudicious. And then they live in this context of 171 million people whose life and existence and their community is. So I think from my own world, I see looking at individual, community, family, social, and everybody has to work to make it work. You're going to train people to work in a society that supports them. You don't come out and then your family says what you touched or you treated this public figure and then you have to keep defending it. It's not everybody that can succumb to pressure or can stand up against pressure. So while the medical school teaches it, it only starts by helping the teachers learn it. The teachers learn it, the students hear it from every angle and learn that differences is not a right for discrimination. They bring that to their learning, So I think it's a big problem overall. And what you're seeing in the medical field is just a reflection of a bigger problem. And it's going to take multiple strategies for us to get where we're going.
All right, now we've been talking about discrimination, coming from the health worker to the patient. Now let's even swap roles, because we know that sometimes discrimination could actually come from the patient even against the health worker. For example, you go for your gynecological, test and you know for a fact that your gynecologist is lesbian. Would you let her touch you?
I think once again, the only reason, not only from my own point of view.
No, I'm asking this as a personal question.
I agree, that's what I'm saying.
Morenike let her, a gay gynecologist.
Me, Morenike,
yes, would you let
I think that's an unfair question because I have no bias against lesbians, gay. It makes no difference to my life, your sexual orientation. If I am in the clinical setting for care, I'm looking for competency. If you're a lesbian, you're not competent, I'm not going to allow you to touch me. If you're heterosexual and you're not competent, I'm going to make every excuse for you not to touch me. And if you are competent for me, yes. And I say bias, I just have no thoughts. I care less of your orientation. It's not the consciousness I live with.
Sekoni,
yeah.
What would you?
I will look at it in the form of, are you a doctor? or are you a lesbian doctor, or are you a lesbian? Which one are you? If you are in your medical practice, in your consulting room, you are a doctor.
She's the gynecologist, yeah.
You are a gynecologist, irrespective of whatever your sexual orientation is.
Okay.
And if you behave in a way that is appropriate, the way a gynecologist will behave, then why not?
Okay.
I'm coming to see you because I need certain skills and competencies which you have, irrespective of what your sexual orientation is.
So at that point, you're not seeing a gay gynecologist. You're seeing a
at
gynecologist
that point,
who's female.
You are not gay. You are not hetero. You are not anything. You are just a gynecologist.
Okay, so now we've talked about prejudice, coming from health workers to patient relationship. Now we know that, I mean, not all health workers are really that bad. Yeah. Some of them really want to do their job, but there are these laws that make their hands tied. So how can we modify these laws, really, Morenike?
Well, in my thinking, I'm aware of one law that in recent times has seemingly hampered healthcare professionals providing services, and one that I'm very aware of in recent times because I also have access to information as to how it has impacted is the Same-Sex Marriage Prohibition Act that was enacted in 2013. Within that act, there's a statement that criminalizes associations with men who have sex with men. I'm very aware of that. And the act does not say healthcare professionals should not provide services, but the interpretation of the law, because of its fluidity, makes people concerned about the implication of association that comes from providing services. And because nobody wants to end in jail, in addition to my personal prejudices that already exist, not mine, but I'm talking about mine in position of healthcare, who already has concern about MSM, the tendency is to deny that. And of course, we have evidences, written evidences from the literature I've read, that simple act have led to increased morbidity and mortalities of those affected. So yes, discriminatory law, in whatever form they do inhibit the healthcare professionals because of their interpretation of it and their non-willingness to face the consequences of the law.
Yeah, forgive me for being radical, but in that context, while the laws are yet to be modified, would you do the don't ask, don't tell?
Two things. A number of healthcare professionals who choose to do that at a risk if the law is interpreted that way. I mean, we know what our police guys, they can set you up and then come and pick you. There are two things. An healthcare professional can face that, knowing that what my hypocritical says is this, and they can choose to stand and face the law irrespective of the consequences. But please appreciate that it's not every person. Usually bold persons can do that, but the minority will choose to be safe. The minority not only chooses to be safe, the teachers will teach their students to be safe. I've seen it happen 1,000,001 times.
Society will teach you to be safe.
To be safe. Yeah. And therefore, in taking the side of safety, the majority of healthcare professionals would not provide services for those discriminated by the law.
Dr. Sekoni?
Well, I agree that we need to be safe because, I mean, you are not only thinking about yourself. The ramifications of being arrested or detained goes beyond the individual practitioner to also even the clinic environment, the institution in which that person is practicing, and so many other things. But it also depends on the kind of care the patient comes to access. Because usually in asking routine questions, you don't ask about sexual orientation. So if the patient comes in and is not complaining about things that have to do with sexual and reproductive health, well, how do you know whether he's gay or lesbian? Because you're not going to ask sexual orientation in your routine questions. And if it comes, for instance, I have fever, I have headache, my joints are paining me, you probably be thinking of something like malaria. And what does that have to do with sexual orientation? So you see, there are instances and there are issues and there are ways where sometimes, you know, the healthcare provider is like in a dilemma and trying to decide, okay, what do I do now? Do I I mean, obviously, this guy looks a bit effeminate, or he behaves in an effeminate manner, so I'm suspecting that, okay, maybe he's a gay person. But considering the fact that he does not have any complaints that you can even relate to anything like that, so what do I do? So sometimes there are issues, so many issues that the healthcare provider himself or herself grapples with on a daily basis. And that is where the issue of your own personality, your own religion sometimes comes in, as well as burnout. The way you will respond if you are burnout will be different from the way you respond if you are probably not. So there are so many issues to be considered for this particular scenario that you can't really say, oh, am I following this way, or am I following this way? It's not clear cut.
I'll raise two issues there. There are two issues, and I think in that kind of scenario, somebody comes in and asks for headache. There's nothing about sexual orientation. However, a publicly open MSM comes and says, I have headache. You have a problem, because the whole world, maybe except me, I'm not watching telly and I don't know, but as he's walking through the gate of the hospital, everybody is looking that there's an MSM going into the hospital, because it's public and the whole world knows it's living openly as that. And then he's
living in your office.
Yep, and then he's working in my office, and there I am. And his headache, it's true, it's Panadol I have to prescribe. I'm already associating. And then I'm there, am I associating? I'm not. I walk out and I walk in, and you're putting that. That's the kind of situation I think we'll deal with.
All right, so just before we wrap up, what will be your final words?
Well, I think for me, my words go to the general public. I think whether we're minorities or majority or whatever you are, we all have right and access to health. My professional training asked me to do two things. Ironically, I also train as a child dentist. It asks me to ensure everyone has access to health, but in addition, it teaches me to speak up for the voiceless. I think at this point in time in a country where the minorities are having challenges to health access because of their sexual orientation, as healthcare professionals, it's a time to speak up, because it's not about a group of persons who might have prejudices. It's setting a precedence that we can transfer and have exactly the same excuse for another world of minorities, which might be me or you, another doctor, to face discrimination.
Wow. Dr. Sekoni, final words?
Well,
to a prejudicial health worker who might be watching, what would you say to him or her?
I would believe that for anybody to say that I want to train as a healthcare worker, you must be somebody that has feelings for humanity. You are somebody who wants to render services. It's all about rendering services. And if you couple that, I mean, if that is the reason why you went to medical practice in the first instance, that you want to help humanity, you want to render services, and then you now take this oath that you're going to render the service irrespective of anything, you will, at the point of need, where somebody comes to you and say, oh, this is my medical problem, you render the service irrespective of political, social, whatever affiliation or prejudice that you have. Then I see no reason why after graduating, you have the license to practice, then you now start denying people access to healthcare at the point of need simply because of a label. I think that there should be more to it than that. It's just not right.
Well, it all boils down to thank you, but I wish I could really do more than that. But thank you so much, Dr. Morenike.
You're welcome.
Thank you so much, Dr. Sekoni, for
being
here on the program. And thank you for joining us on the program. Like you've heard, the professionals, basically, we're humans first, regardless of whatever happens. So if you're just tempted, to, bring in your personal values, your personal bias, or your personal prejudice, you may want to think twice and put a stop to it, and just treat everyone as they truly are. Yeah, it's been the Untold Fact, where conversations that you've never heard before take place. I'm Moses Morgan. Don't forget, it's the hashtag Untold Facts on Twitter. At Instagram, it's at Tears Nigeria, and of course on Facebook, it's the Initiative for Equal Rights. Many thanks for watching.